Minister of Education has sent letters to school boards as to whether exams will continue for the 2020 school year. Minister of Justice gives update with regards to the CFA-TF. But first up, Prime Minister makes presentation to Parliament on COVID-19. Those are the headlines for Thursday, April the 16th, 2020. This is SXM Daily News. I'm Valerie Van Putten. Thank you for joining me. And now for the details. Prime Minister Mrs. Sylvia Jacobs gave a presentation on the coronavirus COVID-19 at the bi-weekly briefing with the Prime Minister at Parliament on Wednesday, last April the 15th, 2020. The briefing is intended to address issues on a bi-weekly basis. In her presentation, the Prime Minister outlined the process of going into the communities to test residents for COVID-19.
Is a particular demographic that was realized, and therefore CPS, together with several volunteers, have gone about the process of actually going into the community. So this was planned for last week, Thursday, Friday, Saturday. But unfortunately, due to the lack of testing supplies that did not arrive as scheduled, it was postponed until this week, and they started yesterday. Yesterday, they went into the soccer garden area. So this is what has been devised by our EOC back office in collaboration with CPS. As you can see on the map, the Upper Princess Quarter area is the lower, this lower section is where the soccer garden area is. And you will see it has isolated cases are the yellow. Okay. Yellow is, oh yes, yeah, sorry. Yellow is quarantine. Purplish blue is isolation numbers, and red is positive. So if we look at the Upper Princess Quarter area, you will see that we have 45 people in quarantine in total there at some point or another, 37 in isolation, and 4 positive. If you look at cul-de-sac area, which is on the map, the whole area from the cemetery in cul-de-sac all the way up to Reward, that is 45, 29 in isolation, and 17 positive. In the Cold Bay area, 35 in quarantine, 26 in isolation, 12 positive. And you can go across, let's see, 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7. So those are the districts as has been determined through the app from the Ministry of Rami. And as everyone can see, these are the numbers. If we look at the positive cases by age and gender, we will see that the average age is 50-ish. And, okay, that bullet isn't working. So I go back to the cases by district. I can pull out also, and this is the EOC dashboard. This is not the one we're using for the public. One of the reasons we are not yet using this with the public is that we do not want persons to misuse the data, zoom in on the map and be able to pinpoint exactly where persons are living, et cetera, for their privacy reasons. And some people feel they have a right to know all of that, but based on doctor-patient confidentiality, unless a patient decides to share that information, it is not normal for the public to be all up in people's medical affairs like that. What we have asked persons to do is to protect yourself. So I hope that through this, I am able to share some current information, show what information is being used to make decisions, and inform that the main priority in all decision-making is that the health aspect comes number one. Secondly, the enforcement or the enforceability of the measures in this health aspect.
And in other COVID-related news, current information suggests that the two main routes of transmission of the COVID-19 virus are respiratory droplets and contact. Respiratory droplets are generated when an infected person coughs or sneezes. Any person who is in close contact within 1 meter with someone who has respiratory symptoms, coughing or sneezing, is at risk of being exposed to potentially infective respiratory droplets. Current evidence suggests that most diseases are transmitted by symptomatic laboratory-confirmed cases. The incubation period for COVID-19, which is the time between exposure to the virus and symptom onset, is an average of 5 to 6 days, but can be as long as 14 days. During this period, also known as the pre-symptomatic period, some infected persons can be contagious and therefore transmit the virus to others. This is supported by data suggesting that some people can test positive for COVID-19 from 1 to 3 days before they develop symptoms. Thus, it is possible that people infected with COVID-19 could transmit the virus before symptoms develop. It is important to recognize that pre-symptomatic transmission still requires the virus to be spread via infectious droplets or through touching contaminated surfaces. Wearing a medical mask is one of the prevention measures that can limit the spread of certain respiratory viral diseases, including COVID-19. However, the use of medical masks in the community may create a false sense of security with neglect of other essential measures such as hand hygiene practices and physical distancing, and may lead to touching the face under the mask and under the eyes. Other measures should also be adopted. Whether or not masks are used, maximum compliance with hand hygiene and other infection prevention control measures is critical to prevent human-to-human transmission of COVID-19. Potential advantages of the use of masks by healthy people in the community setting include reducing potential exposure risk from infected persons during the pre-symptomatic period and stigmatization of individuals wearing masks for source control. In light of the above, the use of non-medical masks, which is simple face cloth covering, such as sewn cloth face coverings or a bandana face coverings by healthy people in the community, is recommended to slow the spread of the virus and help prevent people who may have the virus and do not know it from transmitting it to others. These coverings, fashioned from household items or made at home from common materials at low cost, can be used as an additional voluntary public health measure. The following features related to the cloth face coverings should be taken into consideration. Fit snugly but comfortably against the side of the face. Be secured with ties or air loops. Include multiple layers of fabric, allowing for breathing without restriction. Be able to be laundered and machine dried without damage or change to shape. Healthcare workers, COVID-19 patients, caregivers of COVID-19 patients, and symptomatic people should wear a medical mask. Medical masks are defined as surgical masks or N-95 respiratory that are flat or pleated. They are affixed to the head with straps. They are tested according to a set of standardized test methods that aim to balance high filtration, adequate breathability, and optionally fluid penetration resistance. It is critical that medical masks and respirators, which are in short supply, can be prioritized for healthcare workers. For any type of mask, appropriate use and disposal are essential to ensure that they are effective and to avoid any increase in transmission. Place the mask carefully, ensuring it covers the mouth and nose, and tie it securely to minimize any gaps between the face and the mask. Avoid touching the mask while wearing it. Remove the mask using the appropriate technique. Do not touch the front of the mask, but untie it from behind. After removal, or whenever a used mask is inadvertently touched, Clean hands using alcohol-based hand rub or soap and water if hands are visibly dirty. Replace masks as soon as they become damp with a new, clean, dry mask. Do not reuse single-use masks. Discard single-use masks after each use and dispose of them immediately upon removal. And still to come, Minister of Finance has submitted stimulus and recovery plan to Parliament. We'll have the details of that story and more when SXM Daily News returns.
GEBE has been faithfully serving the communities of St. Martin, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Our friend Megawati is here with tips to save you energy. 1. Turn your airco temperature up. 2. Use a ceiling fan instead. 3. Buy energy-saving products. Save some green with NVGEBE.
And as SXM Daily News continues at this time, Member of Parliament, Mr. Claudius Boncamper, is requesting answers from the Prime Minister about the aid that has been requested for St. Martin. He questioned the conditions under which St. Martin has been required to set. The Member of Parliament says he is baffled about the conditions for the aid.
There are conditions to be set, they are stating. And one of the conditions is that they want to make government leaner. Is that a condition we want to entertain, especially at this point in time when so many people have already lost jobs and government is one of the only entities where at least you have certain securities with job security, that now we were going to mash that one up too because they want to make that a condition if we want to get a aid. And the other condition, Mr. Chairman, that has me a little baffled to you, Madam Prime Minister, is the condition of the CDA second chamber with the progress committee that the prison must be on the budget. And secondly, basically the police force should fall under the Dutch police force because those things don't really work. I think that's an embarrassing statement that was made by the MP from the CDA. And I think government should make it very clear that not everything is negotiable under the sun to give us aid. Yes, we need aid, but not at all cost either. So just those two questions I would like there. And then in the testing, Madam Prime Minister, you spoke about hotspots and you showed on the dashboard, which I really like because it gives an indication at least. And we will have to differ on the privacy aspect. I think national health trumps privacy, personal privacy at all times, but I respect the position of government on it. But I say, better that I know somebody beside me has COVID-19, that I wander out in my yard and I have a social discussion with the person across the fence. They make a cough and the next thing I have COVID-19 because I didn't know that they had it. Because not everybody is moved seemingly out of their homes based on this hot spotting that I'm hearing. So I'm a little cautious with the hot spot because a lot of people, Madam Prime Minister, are not coming forward because they're illegals. And illegals are dead scared that they're going to be sent back to their country the minute things get better. Is there any way that we can ask people to please come forward? There isn't going to be no threat of repatriation to your country right now. Sure, we have to deal with illegals after the fact. But at this point in time, please come forward and save not only your life, or those of your family, but also the surrounding community.
Prime Minister Sylvia Jacobs, meanwhile, in response to the Member of Parliament, gave a breakdown of the agreement that was discussed with her counterparts in the Netherlands.
Question number 4, which was related to conditions for the aid. The government of St. Martin has not received any conditions. If the Tweede Kamer parliamentarians, who are the colleagues of the sitting members of parliament here, are making those statements, they are part of the coalition that is now in the Dutch government. They say they are being the one that is proposing that that the progress or the prison is on the budget. It's on the budget. It has been on the budget for capital investments. And as a matter of fact, the afspraak with the Dutch was not kept. And therefore, our 2019 capital investments were not sent and has still not been sent to the CBCS for us to be able to make the necessary changes to the prison. And I made that very, very clear to them when I attended the Kingdom Council of Ministers meeting in January. So while we are always being told afspraak is afspraak and you won't get this unless you live up to this, I clearly described to them that if we're going to hold us to an agreement, and the agreement was also that we would receive the necessary capital investment funds to address the same situations we are being, pulled by the neck for, which was the fixing of the prison as well as improving our financial management of government. Both of these things were part of our 2018 and 19 capital investment, but we did not receive the funds for it. And so I was also able to throw back the afspraak is afspraak into their faces, which they had to acknowledge was the case. So with the still, because 2019-20 budget isn't finalized yet, that was a condition to receive these funds. But based on the fact that COVID-19 and its reality, they released the funds prior to the budget being passed. So that has been done. However, the capital investment has not been transferred, and I will be taking that up with them in the meeting tomorrow as well.
And in other news at this time, Minister of Justice Anna Richardson gave an update of the CFATF and the plenary session that has been pushed back to November 2020 due to the COVID-19 pandemic. The Minister of Justice was at the time speaking at the virtual Council of Ministers weekly press briefing of April the 15th, 2020.
Just to bring to your awareness, on April 6th, as Minister of Justice, I officially received a notice from the Secretariat from the CFATF that is based in Trinidad and Tobago, giving St. Martin the opportunity to know that the plenary meeting that was scheduled for May 2020 due to COVID has now been pushed to November 2020, which gives us additional time. Notice had already been received by St. Martin by our director of the FIU or our MARC department, Ms. Ligia Stella, back in March. But again, as the minister, I officially received that notice. Also on the 6th, in the late evening, I did share that communication with the chairman of parliament that he would then share with the members of parliament, as I had promised in our last meeting. On April 8th, I held a meeting with my legal team, who is now busy as well, doing the necessary updates and amendments to the proposal to Parliament, as we are seeking to reconvene the meeting with Parliament within this week to next week. And that is within the scope that I requested. I requested 3 weeks with Parliament, and I believe we're arriving at the point where we can have discussions now with Parliament and come under consensus for the betterment of St. Martin. To that regard, I am really excited about the fact that we are looking positive to move St. Martin from the 3rd round to the 4th round, and by that extension, receive the opportunity for the grey listing statement on St. Martin to be lifted, and then we continue to move positively. I am also having discussions with Ms. Stella for us to identify the ownership and management of CFATF matters going forward being under the MOT, but I'm also trying to identify for an ambassador to be established at the headquarters of the CFATF.
And in more news from the Council of Ministers press briefing, Minister of Finance, Ardwell Edion, says that the stimulus and recovery plan has been sent to Parliament for their review. He also announced that St. Martin has received our shares from the UTS sale in the amount of 10 million guilders.
The Ministry of Finance, we have sent the stimulus and recovery plan to Parliament for their review. We've also gotten the remainder of the money from UTS, which is a little over 10 million guilders, and the 2019 liquidity support has been transferred to the central bank in the amount of 44 million guilders. No decision has been made by the Netherlands in the amount of support financially, other than it being more than likely a loan. There was supposed to be a Kingdom Council of meetings this week, but as I understood, it will now be held on April 24th, where a decision more than likely will be made. We are in constant communication with the CFT and hoping to have a favorable decision next week. Seeing the current timeline, we have decided to start the execution of the stimulus plan with our current liquidity support and hope to have our website launched by the end of this week.
And now, turning to our weather forecast for April the 16th, 2020. A relatively stable atmosphere will continue to restrict precipitation across the region. Meanwhile, the Atlantic high pressure system will generate a gentle to moderate wind flow. Seas will remain slight to moderate during the next few days. Now, let's turn to your 3-day forecast. And still to come, leader of MJR on French St. Martin is worried about the reopening of schools on French St. Martin. We'll have the details to that story and more when SXM Daily News returns.
Make use of WIB mobile banking with easy access and direct usage of face recognition, PIN code, or fingerprint. Download WIB mobile banking app and make your transaction from anywhere at any time. For more information, visit wib-bank.net/quick-login.
And in news from the Ministry of Education, Minister of Education Dr. Anders Rodolph Samuel has sent a letter to the various school boards as to whether or not exams will continue for the 2020 school year. The minister says he is following the process from EOC and the Council of Ministers.
I have sent a letter to the school boards, and the letter was primarily in regards to whether or not exams at this moment will continue. I have noticed that the letter was received because there were school managers that indicated that they have received the letter. What is happening, Wendell? At this moment, I am following the process from the AOC and the Council of Ministers. And when we reach to the stage where we can decide if schools should be open, this would be a joint decision, not necessarily from the Minister of Education alone, but I believe we have to take a decision that would make sure that everyone is safe. We do want to go back to school, I can imagine this, but that time when the decision is taken, I will definitely concur with my colleagues to make sure that we are doing the right thing at that moment.
And in news now from French St. Martin, the news that France and all its territories will be returning to normal life gradually as per May the 11th has been met with concern from especially teachers in the French Caribbean about the COVID-19 virus, which is still spreading. The islands of Martinique, Guadeloupe, St. Martin, and St. Bartholomew have a total of 342 cases of the novel coronavirus as of April the 13th, 2020. France's Education Minister, Jean-Michel Blanquer, said schools will not reopen overnight, but will resume in small groups and reduced hours. That issue was put to Councilman and leader of the MJP, Louis Mussington, who is also an educator by profession. According to Mr. Mussington, this matter has to be given some more thought and be properly ironed out.
All who listened to the President's address they are fully aware of that statement, and of course supported by the Minister of Education in Paris. Well, there's a major concern, and you are highlighted that as well, coming from the parents, coming also from the teachers' union. I have read two communiques on social media, where they're clearly stating that in this, given the present circumstances, they are, as teachers, they will not be participating in this, what they term hurry up, a precipitated reopening, given the number of cases, confirmed cases on each territory. Parents are echoing similar concerns because they are saying there's no way, given the uncertainties as to how safe their kids would be in the classroom, given the fact that the measures, the barrier measures which have been implemented thus far will not be respected by young children in the classroom who would not know what these measures are, so to speak, and rightfully so. So I think that this matter has to be given some more time, has to be properly ironed out by the competent authorities in Paris. Well, the President did say in his address that it will not be an overnight process, and his government would be studying the matter very seriously, very profoundly, so that they will be able to put all this whole strategy in place gradually.
And still to come, Dutch hospital staff honors colleague who died of COVID-19 in the Netherlands. We'll have the details of that story when SXM Daily News returns. And as we end this edition of SXM Evening News, this item out of the Netherlands. Hospital staff honors colleague who died in COVID-19 during the funeral procession. Dozens of hospital workers lined up outside the Erasmus Medical Center in Rotterdam to pay respects to Ram Ramratan, their 60-year-old colleague who died from respiratory illness COVID-19. Ramratan worked at the hospital for 27 years as an assistant in the radiology department. His funeral passed the hospital as dozens of employees applauded. Many laid flowers on the hood of the hearse as it slowly drove by. The hospital would not say whether Ramratan contracted the novel coronavirus which led to his death. It did state, however, that none of its employees was known to have been infected with the virus through the course of their work at the medical facility, according to the newspaper article. And with that, it brings us to the end of the SXM Daily News for this evening. I'm Valerie Van Putten. Just a reminder that this and other programs are available online. Simply log on to stmartinmediacenter.com for viewing. And on behalf of SXM Daily News team, we thank you for watching and plan on meeting you right back here again tomorrow.